thank you for holding this important hearing this morning and welcome the panel. I'd like to thank each and every one of the witnesses who have taken their time to provide this committee, or will very shortly, their testimony this morning, and I want to especially welcome a fellow Cincinnatian, Jim Eckstein, whom I'll introduce briefly later. The cost of health insurance in general is rising faster than inflation, while the percentage of individuals without health insurance, unfortunately, continues to rise. Today, more than 47 million Americans are without health insurance. For small businesses and their employees, soaring health costs are a critical issue. The cost of health insurance continued its 20-year reign as the #1 issue worrying small business owners, according to the NFIB. Roughly 63% of all uninsured workers are either self-employed or work for firms without more than 100 employees, in other words, fewer than 100, and that estimate is by the Employee Benefit Research Institute. According to the National Small Business Association, in 2007, only 47% of businesses with fewer than 500 employees offered health insurance, and that was down from 58% about 10 years ago. Our current system of health insurance and health care is financially unsustainable and threatens the health and financial security of small businesses and, most importantly, their employees. Large employers, unlike small businesses, are able to spread risk more broadly among their workers and enjoy economies of scale that keep administrative costs lower than is true in the small business community. When a large employer self-insures, its health benefits are not subject to state insurance laws and regulations because it's not defined as insurance. This, along with the broad risk spreading and low per person administrative costs, confers a considerable cost advantage over similar benefit plans in the small group or individual markets for insurance. Healthcare insurance reform should make the market for health insurance more competitive, resulting in greater access to quality care. Healthcare policy reforms should balance the competing goals of access to quality care, affordability, and predictability, and consumer choice. Madam Chair, I look forward to working with you on this important issue, and I want to commend you for your hard work and the attention that you've focused on this very important issue over the last 2 years. As you indicated, we've had a number of hearings, and I know that you appreciate, as I do, the importance of this to the small business community. So thank you for holding this